Good morning, all. Once again, I welcome to all of you in today's session, today's part, that is Autocoids second part, and self-remedy. In first lecture, what we had seen, what do you mean by Autocoids? What are the different examples of Autocoids? And in that one example we took, that is a histamine, how histamine is work as an Autocoid, and how the histamine is work in our body with the help of some receptor called as H1 receptor, H2 receptor. Then today we are going to see then what is the line of treatment for that. If histamine is the reason, if histamine is the point that causes some complication, then how could we treat this? Even though this histamine is act as a self remedy, so it has one wonderful action, that is wound healing action. But when it has some normal activity, but when it is get released in high dose, high quantity, then it is necessary that we should avoid it. Then how it could be avoided? So definitely with the help of antihistamine drug. So in that antihistamine drug, we had seen the classification of the drugs which are acting as an antihistaminic, like H1 receptor blocker, and another one is H2 antihistaminic drug. So these are the ones that we had seen in our earlier lecture. What today we are going to see? Today we are going to see what is the pharmacological action of this antihistaminic drug. What is its antihistaminic effect? How does it produce its action on other parts, other areas like central nervous system, some local anesthetics, some cardiac depressant activities, as well as some other autonomic effect and some miscellaneous effect we had seen. So along with this, today also we are going to see what is the side effect of antihistaminic. If we are using this antihistaminic so repeatedly, so frequently, what could be the possible side effect it has? And one of the very important thing, that is nothing but in what area we could prefer this antihistaminic like therapeutic uses. So let's start with today's session, today's part, that is first part, that is pharmacological action. The first we are going to see its pharmacological action as an antihistaminic drug. Here there is one very wonderful fact come in front of us that this drug effectively antagonizes the action of injected histamine on smooth muscle. That is a very important thing. But may not always prevent the similar effect occurring in our body due to some allergic reaction. This is very important. Why does it happen? Because this asthmatic bronchoconstriction is unaffected by the antihistamine, but the bronchoconstriction is induced by the injected histamine is readily prevented because of one reason. What is that reason? The reason is this, that competitive antagonistic effect. Endogenously released histamine is not easily reached by the competitive antagonistic. That is one of the very important, most important thing why it doesn't work, because of its competitive antagonistic. But it not easily reached by the competitive antagonist. In allergic reaction, there are some other substances who also release, like an iodoxytryptamine and other slows a slow releasing of substances which are not antagonist. So this is one of the fact that why these antihistaminics are not that much effective in allergic reaction, but they are effective in whenever there is an endogenously effect. That is the important thing. Externally, when we administer the drug, histamine, then it could be having an effect. That is the first thing that called as an antihistamine. Second one, there are certain other areas where it could produce its action like a central nervous system. Central nervous system, that is definitely it is related to our all oral activity. So what is the effect of histamine, antihistamine? That is these normally are sedative in action. These normally have a sedative action. But again, there is one here. Another thing is that whenever you use it in a high dose, it may produce excitation. So one thing is that it has a sedative action. So as it gives a sedative action, so definitely it is difficult for those who are driving. They are not safe for it. As well as it is also helpful, or it is also used to get relief from the motion sickness. Motion sickness that many of the people are, we are having one complication, having a problem whenever we are sitting in opposite direction and we are traveling in a bus or any other car or anywhere. So at that time we are getting little bit vertigo and nausea or vomiting, that we call as a motion sickness. So that motion sickness is also get relief from this antihistamine, as well as in early vomiting stages of pregnancy. It is also used for the treatment, and somewhat tremors. Now these are the specific tremors we could see in old age patient, and that particular condition that we call as a Parkinsonism. Why it is in a Parkinsonism? That is, it is imbalance between the increasing stimulation of skeletal muscles and control of the restriction of the skeletal muscles, that we call as Parkinsonism. And that Parkinsonism, whenever the patient is having Parkinsonism, due to this shivering, he is try to control its shivering. That called as a rigidity. That we call as rigidity. There, these movements, hand movements and skeletal muscle movements are that are not so easy. He tried to control these tremors. So that's why he is having some rigidity. So to reduce this rigidity as well as to reduce this tremor in Parkinsonism, sometimes these antihistaminic drugs are having effect. That, as just told you, as this having a CNS depressant activity. In normal doses, it has a CNS sedation activity, and because of its sedation activity, somewhat it is a dangerous for those who are having a driving car or having working on heavy machines. So we need to avoid this therapies, or we need to avoid this therapy whenever we have this heavy working on heavy machine as well as driving the cars. Another, apart from it, another one thing is that is the local anesthetic. Sometimes it could be used to potentiate, the local anesthetic. We could use the combination. With some antihistaminic drug. This antihistamine have a quite potent local anesthetic action. Whenever we could use in combination, that is one more its benefit. Next one is a cardio depressant action. This is one of the very important thing that we could have seen. Some of these antihistaminic have cardiac depressant action, particularly in arrhythmia. Particularly in arrhythmia, it is used in treatment of arrhythmia. So that is one more its benefit. Next one is that what is its effect in pharmacological effect in autonomous effect. In higher doses, these antagonize the acetylcholine. In higher doses, they antagonize this acetylcholine. Means acetylcholine antagonize means what? It has an antagonist action, that it is nothing but it has an action like an atropine, definitely. So as it work as an antagonist of acetylcholine like an atropine, so definitely it might be have a chances of having the same activity like an atropine like actions, because it is antagonist of acetylcholine. So antagonist of acetylcholine antagonist is an atropine, so it also has some atropine like action. And whenever we have an atropine like action, so one thing that could be recognized, that is in a dryness of mouth. Second one is in a nasopharyngeal secretion. It decreases its nasopharyngeal decretion. It decreases the nasopharyngeal secretions. And most important thing there, they have some symptoms like an sympathomimetic effect. They have some symptoms like an sympathomimetic, because as it antagonizes the acetylcholine, definitely it antagonizes the cholinergic system, so it has an action as like a sympathetic system, adrenergic system. So this is the effect that we call as autonomic effect. Apart from it, there are some other effects that we could consider in some miscellaneous, like some of this antihistamine has histamine release. Some of these antihistamines are releases histamine. Why? Some are having anti-5-hydroxytryptamine action. Some are also having against anti-5-hydroxytryptamine action, as well as in hypersensitivity reaction due to tropical use. This H1 antihistaminic effect, it sometimes it could be preferred in hypersensitivity reaction. So these are its application that we had seen. Then the next point is what are its possible side effects. The possible side effects, like it has a drowsiness that we had seen. due to the action on the central nervous system, it has a drowsiness effect. So it is not good for the driving as well as working on heavy machine. Second thing, it enhances, it potentiates some action of a certain class of drugs like CNS depressant. From that CNS depressant, the class like some tranquilizers or MAO inhibitors. These are the some monoamino oxidase. These are the inhibitors. This is one class of drug which could be used in treatment of the depression. So these MAO inhibitors and tranquilizers, on this they have an action. Second thing is that it has also, if any drug is having any serious side effect, then we could use in combination, and it could try to reduce this side effects, try to reduce this side effect. Next one is, it also has, that we had seen, it has an anticholinergic effect. So the effects like dryness of the mouth, some blurred vision, this type of effects are also seen. Dryness of the mouth and blurred vision. Vision is not clear. Why vision is not clear? That we are seen, as it is in the anticholinergic. Cholinergic drug means that is a parasympathetic system. Parasympathetic system is acting. Parasympathetic, P for parasympathetic, C for circular muscle, C for contraction. So contraction of the pupil is not there. So due to constriction of pupil is not there, that is nothing but there is a dilation of pupil. And whenever there is a severely dilation of pupil, there is little but unable to see the patient, which is a near vision. So due to that, the vision is not clear. That's why we have a blurred vision. Why it is all the things? It is because only a anticholinergic effect. Then what are its application? What are its application? The most important thing is, these antihistaminic drugs are having anti-allergic action. It used in treatment of allergic reaction, particularly where, like in hay fever, like urticaria. Hay fever, that is nothing but the sneezing, inflammation, allergic rhinitis, likewise. So in these cases, in hay fever, urticaria, in allergic rhinitis, this antihistamine could be preferred. Secondly, it also used for the treatment of motion sickness. Preferably, promethazine is used for the treatment of the motion sickness. In market, we can say Pravasi Goya. So likewise, these are the specific brand names of from the same molecule that it has a application in motion sickness. But use in nausea-vomiting in pregnancy is contraindicated. That is one of the very important thing. For exam point of view, we should know that contraindication. What is the contraindication of promethazine? It is get contraindicated in pregnancy. And last one is that it has an also used in treatment of management of cardiac arrhythmia as well as in treatment of the Parkinsonism. So these are its applications where it could prefer in allergic reactions, prevent treatment of the motion sickness, in management of arrhythmia as well as in management of Parkinsonism. So these are the applications of antihistamines. So this is what our today's lecture that is related with the autocoids. Here we have finished this point, autocoids, and that is antihistamines. Thank you very much.